And as we get started, I also wanted to thank our sponsor for today's event, which is Reach King County. Reach King County is business retention, expansion, and collaboration hub for King County. And it's actually part of the chamber as a whole. It's a fantastic program. Vaughn Taylor, the vice president over that program, is able to talk with businesses about how they can expand and grow and really help incubate the growth within our region. So if you or someone you know would be interested in those services, please reach out to the Seattle Chamber and they will get you connected with Vaughn and the team. All right, first, I would like to introduce our first speaker, Shannon Braddock from King County. She is the Chief of Staff at King County and always a joy to have on our program to kind of help inform us about what is happening. So Shannon, I will turn it over to you and I will turn my camera off for a few minutes so people can, just focus on you and hear about the update in the order, and then I will rejoin you in a few minutes.
Thank you. Thank you so much. Hey, everyone. Thank you so much. And I want to give a real shout out to the Seattle Metropolitan Chamber. Throughout the pandemic, they and all of you have been really great partners as we've moved forward. This kind of communication and ability to share information and answer questions is it's a real big deal. We feel really strongly that this partnership has helped King County do as well as we've been able to do during this incredibly challenging time. So thank you. So I'm just here to discuss that, as you all know, last week we announced that effective March 1st, we would be lifting the vaccine verification order for certain venues in King County, the venues that were covered under the order, generally restaurants, gyms, entertainment venues. And that order is being lifted because Dr. Duchin, who is our public health officer, has determined that the order was put in place to help fight the surge that we knew was coming, the winter surge, basically, while we could then increase vaccination rates, hopefully prevent spread, all of those things. We have indeed increased our vaccination rates between the time of the order going in place and now. It went from about 68% for the total eligible population to over 80%. And frankly, Omicron sort of changed the dynamic, right? Omicron was so people were able to spread that even while vaccinated. So the shift became that obviously everyone who is vaccinated and boosted is much more protected in that space, and masks continue to be a big deal. And Dr. Duchin continues to talk about all of these things as the most important preventative measures. But as a government order, a public health order, he did not feel this order was necessary anymore. It does not prevent businesses or organizations from continuing to keep vaccine verification. And I certainly know that in the cases of some of our large entertainment venues, for example, there are union contracts that require them to keep a vaccine verification order in place, I think till May. So we will certainly see in some spaces in King County, people will choose to continue checking vaccines. And that's great. Like, we obviously think anything we can do to continue to prevent spread of the COVID variants is really important. But basically, as a health order, it was set to expire March 16th. And the decision was made that we could lift it a little bit earlier, March 1st, and have some time for businesses and organizations to ramp down that order. So that is the decision that's been made by King County. I'll highlight a couple other pieces. King County, as an employer, we do require vaccines for all of our employees. It is a condition of employment, and we will continue to keep that in place. We feel that's been really important in getting, protecting, frankly, the public and in getting vaccination rates up. And so that mandate for King County as an employer will remain in place. And then another flag I will make is I know the state announced that they will be lifting as of March 21st, the indoor mask mandate. So that will be lifted by the state. The King County Public Health Officer does have the ability to put an indoor or keep an indoor mask mandate for King County, should he feel that that is appropriate and necessary. He is continuing, Dr. Duchin is continuing to look at the data, see how the trends continue to go. So far, so good. We're continuing to see our trends going down. We would love to stay aligned with the state, but we are not yet comfortable in definitively saying that we're able to do that. So Dr. Duchin's going to keep looking at data. We've got a little time here. So over the next couple of weeks, he'll continue to look at that. And then you'll hear from King County whether or not we'll be able to go along with that and align with that date from the state. So I think those are really the basics, but happy obviously to answer any questions as we move forward. Thanks.
Yeah. So I always like to, my style definitely is as I process to regurgitate. So let me make sure that I even understand the order correctly. So within King County, March 1st, which is earlier than originally slated, will no longer have the requirement for businesses to have the Vax Verify, but businesses for whatever reason may continue to do that beyond that point. And that in the coming weeks, Dr. Duchin with King County will evaluate if a mask mandate is still needed or if that will also lift in King County as well with the state. Does that cover the high points for us?
Yep,
Great.
I think so.
Fantastic. Well, so Shannon, we have a few other folks that I will invite to join us for a panel discussion. We have Jill and David. Hello. David Cruz is from Slalom and Jill Jackson from Monument Advocacy. I would love for the two of you to introduce yourself, and we'll be talking a little bit about kind of what this means and what businesses do from here. So Jill, do you want to start and introduce yourself and then David?
Sure. I do communications and public affairs work for Monument Advocacy, and we work with the Seattle Metropolitan Chamber of Commerce. So we've been thinking throughout the KC Vax Verified order that in partnership with King County about sort of the messaging and how we can arm employees and business owners with kind of how to talk about the order and how to talk with customers and provide toolkits and all kinds of resources. I also myself, I'm a former journalist. I was the news director at KOW for 3 years. Prior to that, I covered Congress for CBS News and was at Face the Nation. And I, back before that, I worked in restaurants and bars, and I worked at a gym, and I've done a lot of customer service in my life. So I kind of understand what you can face sometimes, both with customers and sort of the dynamics in the service industry.
Great. And David, over to you.
Awesome. Thank you. So my name is David Cruz. I'm the director of our Global Resilience and Safety organization here at Slalom. We are an amazing modern consulting firm that's headquartered here in the Seattle area. And I get to lead our safety team, which encompasses all of our COVID and health safety practices for Seattle and, of course, globally for our 40 offices that span the entire globe.
Great. So as we get started, there's a couple things, we're going to be talking about what employers can do from here. And I guess my first question, Shannon, is just to clarify, what if employers are still allowed to request that people show a Vax card as they have customers come into them? Oh, you're on mute.
Sorry about that. Yes, much like, no shoes, no shirt, no service, private organizations can put those parameters in place should they choose to do so. Yeah.
Great. So the first question I have is how can an employer maintain employee or customer safety after this requirement ends? David, love to hear your thoughts and from the other two panelists as well.
Yeah, absolutely. I think the last 2 years has provided us a lot of good information and our learning from the pandemic. We can't predict the future, but we can take what we've learned to better prepare for what we're calling the next normal. And really what that means is, in the absence of government mandates and guidelines, everyone here still wants to make sure that our team members and our clients are safe within the workplace. And we've learned a lot over the past 2 years on how to create a safe and productive environment for everyone. That's really what's at our core here at Slalom, right? Is using a best for all approach as we begin to transition to that next normal. And for us, right now that starts with having really good situational awareness and actively monitoring what the virus is doing in our local communities, as well as in other areas around the globe. And what does that really mean? Well, for us, we created a really simple framework for gathering data and information about the virus, which we regularly review, analyze, and allows us to make informed decisions on how we work, how we occupy offices, how we hold events, and how we safely enable global travel. So I know you're probably saying to yourself, like, well, what kind of data information? And I'm so glad, we had the wonderful representative from King County, because we rely on those local and state public health and emergency management agencies, including here in Seattle and Washington State, to publish really good data information on positive test counts, hospital capacity, ICU bed availability. And those are really the key markers in us tracking the trajectory of the virus. So there's a host of other data things that we like to look at, including monitoring sewage samples in local communities. And that's really an amazing way to know how much virus is circulating within a local community. And then, knowing what happens here at home is really important. So, we want to take a look outside our borders as well at other urban areas across other states and countries, because that's equally as important. You say, why? Well, as you guys can all probably remember, Omicron showed up in other countries first. That provided us really good visibility into how the virus was going to react and spread within our own community. And within a week, we knew it was more transmissible because of the test counts that we were seeing in those other countries. We also knew it was less likely, less virulent because of the hospital data that was coming out of those countries. And then we were able to really closely track the information from those healthcare systems on the vaccine efficacy. So bottom line is, for us, for Omicron, by December 7th, we knew the Omicron wave was going to hit the US urban areas very, very hard. And by December 15th, we could also anticipate that Omicron, the surge was going to be very short-lived, likely waning by the end of January. And all of that has basically kind of come true. We also knew that high percentages of vaccinated populations would not see overflowing hospitals or shortages of emergency medical services. So to kind of come full circle here, monitoring the virus is really what we believe is really important. It's what the next set of variants for the virus are going to be capable of from a transmission perspective, from a virulence perspective. And really just having everybody here understand, this is how do we establish that risk environment where we live, where we operate in, and supporting us to all sort of build our next normal. That kind of help a little bit?
Yeah, it does. I'm wondering if you could talk a little bit about some of the strategies that you have seen in your consulting practice around what employers might consider, keeping in place. I'm thinking there's been daily health attestations, there's been testing requirements, there's been vaccination requirements, masking. What are you seeing as some of those best or one thing for all type things that employers should still be thinking about?
Yeah, so just to clarify, we're subject to the federal guidelines as a federal contractor. So we don't have a lot of flexibility today, but in the absence of that going forward, some of those key things that we're looking at is, expanding test capability for our team members at home, as well as on-site testing when necessary. So we talked about, again, monitoring kind of what happens in and around the environment, but making that testing a really simple and frictionless process, leveraging both antigen tests and molecular tests that have lab quality, as well as having the capability of expanding those tests to include professional proctoring with like a remote medical professional, so that we could meet the requirements for global travel should those things kind of come back. Additionally, we know improvements in air quality is really important. We know that this virus likes to thrive where there's stagnant air, and making improvements to the indoor air quality don't always require massive investments or take years to implement. There are a variety of ways of improving indoor air solutions to address this and help create a safer indoor workplace. And mostly I'll really say is, just making sure that whatever we do and what other companies do, just making it really nimble and flexible and adaptable to the way the virus is moving. I think that's the one thing. You don't need necessarily a one-size-fits-all approach all the time. What you really want to implement is something that can flex between when virus levels are really low, like what we're seeing right now, and how to adapt to that next wave of the next peak. And those are really sort of the brunt of the changes that we want to start looking at.
So Jill, talk to us a little bit about your thoughts around what to say and communicate to employees. As an employer, you have these changes. What are some of the best practices or things that you all are seeing or recommending in terms of culture, safety, and reiterating these orders, right? I think sometimes, even though they're pretty generally clear orders, people still get a little confused of when things end, et cetera.
Exactly. I think I think it's important to first, I mean, today, make clear that all of your employees are aware that the vaccine verification requirement is still in place for another week. And you don't want to set the precedent now after all this time of kind of just throwing your hands up and being done with it. I think it's about, we're going to model that we are a business that follows public health advice, and we do it to the letter. And so we're going to enforce it till the end, and kind of going into it knowing that I think that message is good, and that, like, if for some reason public health had to bring the requirement back, kind of everyone knows that if that is the case, that's what this business does. They follow the recommendations. I also think it's really important to keep talking to your employees, really to listen to them and understand what their concerns are, and try to address their concerns to the best of your ability as an owner or manager. And I think one thing I would say is, like, if you're trying to foster a culture of safety, you want to be responsive to their safety concerns, especially things like customers taking frustrations out on workers. I think that employees need to know that their own personal safety is your top priority, and that, and remind them of kind of the training we've done up to this point, where if customers are refusing to comply, offer them alternatives like outside options or takeout, or a web option for viewing something, or the things that they can provide to kind of escalate the situation, and remind them again not to physically engage with customers if they become violent, and that they should call 911 if a customer becomes violent. But I think, just again, it's really important to be showing your employees that they're appreciated and that they're playing a really important role in keeping people safe, and that you're willing to kind of talk through their concerns and even talk through how they might talk to customers about the order before they're on shift.
Yeah, those are really helpful strategies, and a few points for us to be considering as we're evaluating as employers if we keep this in place at our workplace as well. Shannon, I have a question for you around, there's a question in the Q&A about, is there a recommendation for masking in offices? And maybe you could talk a little bit about right now, and then, in the future, what that might look like.
Thanks. For now, so I will tell you, for King County, for our own spaces, what we are doing now is requiring masks in any areas that are publicly accessible. And the reasoning behind that is because we at King County, obviously, we need to be vaccinated to be at work unless we've been accommodated in another space. So we know the vaccination status of those people around us is the assumption in that space, right? So really, I think the recommendation that Dr. Duchin would say is, if you're in an indoor environment where there's a crowd of people and you don't know their vaccination status, and maybe it's not even a crowd, but maybe it's a small space with just a couple of individuals and not a lot of ventilation, I think Dr. Duchin would recommend wearing a mask in that environment, because you don't know what the vaccination status is and that space. Again, we are kind of, as I think David put it very well, needing to be nimble and flexible, understand that different environments will have different needs. And so for King County, if we're in a publicly accessible space, we will be required to wear masks. In our own office spaces, we are not required to do that, because it's in the spaces that are not accessible to the public. Some folks do have offices in publicly accessible spaces, so obviously they would need to wear a mask in that space. But for those of us who are in non-publicly accessible spaces, we don't necessarily need to wear a mask, though some folks might choose to. Again, I think this is going to be a big transition, and people who are really excited to get rid of all of the preventative measures, and people who are really nervous about it. And everyone has their own personal reasons in those. And so I do think the transition is going to be challenging for a lot of both individuals and places where individuals gather, because it's been a hell of a couple years. We've had to adapt to a lot of things. It's been painful and challenging, and just seeing this sort of shift, I think there are folks who want to shift real quickly, and then there are others who are just very nervous about it. So I think the other thing we're trying to do is make sure we're creating a respectful environment for both of those views, right? How can we manage in that space?
Absolutely. describing it as this transition phrase is so accurate, right? And people will have different personal protective measures that, have a very big range of reasons. My son, who's 7, was listening to the news the other day, and he was like, wait, why wouldn't we wear a mask? But isn't it, this is what he's done for the last 2 years as from early, late 4 to now 7, and just trying to understand what that means, how you explain that, how you make choices as families, as employers, as citizens. So it definitely will be an exercise in flexibility and kind of values for everyone. Jill, could you talk to us a little bit about how businesses or employers might continue to verify if businesses choose to do so after the order ends?
Absolutely. First of all, you can take down your sign after March 1st, and you should go to kcvaxverified.com, and we've updated a sign, so you can put it there, and it will be give your customers, and this is for everybody, this will give your customers the latest requirements, basically. But for businesses thinking about continuing the verification, I think it's, again, really important to talk with staff, because if say 100% of your staff wants it dropped, the owner's going to have a hard time getting employees to enforce it. So there needs to be some conversation there. And the same is true if many of your staff want to keep it. But what's important is that, again, you're talking to them, that you're getting people on the same page, getting people to feel comfortable with it, making sure that they have the tools to enforce it if you have it. If employees, and part of that is giving employees language even that they can use with customers. So, I've actually written out some, just phrases, and it's going to be somewhat different depending on your business. But, sometimes it's going to be, we've heard from the majority of our customers that they're more comfortable knowing other patrons are vaccinated, and we're responding to that. It can be, we understand King County's order is over for now, but many of our employees and customers feel safer at this time knowing patrons and employees are are vaccinated. And then there's we are taking one thing at a time. We're going to continue talking to our customers and among our staff to best understand what makes people feel safe and most comfortable. And you could also point to, union agreements if as Shannon mentioned, there's a union agreement in place. But I think it's about kind of encouraging your employees also to listen to customers, and you listening to your employees, encouraging your employees to listen to customers, and kind of having kind of a calm, we're listening, we're taking things one day at a time. This is how people feel safe right now, today.
Yeah, those are really helpful things for employers to think through right now. Lee, thank you so much for putting the link to KC Vax Verify in the chat. So there are some really great resources in there or on that link that I really encourage you to take a look at. And as Jill mentioned too, they've been updated, right? So previously they had the KC Vax Verify poster, and now, some tools for as businesses make decisions that are business decisions for whatever reason they decide to continue to do that. So I think the last question that I have for each of you is, what piece of advice would you offer to employers right now as they're thinking through these decisions, both internally for their staff and for customers externally? And I will start with you, Shannon, because you have a smile. I think I know what your piece of advice will be, but turn it over to you.
Yeah, I think it's really also what I said before. I think really acknowledging and understanding that each individual is going to have a different reaction to this transitional phase of the pandemic. There's no question. And so I think preparing for that and acknowledging that is really important, and setting the context that, Jill was just talking about, I think is going to be really powerful for folks. And then I would also say, be nimble, be paying attention to our COVID dashboards. Obviously, we'll continue at King County to be providing public health information quickly as we can based on any trends we see that are concerning. And we are very hopeful that this is the last phase that we are in, and we don't know. We don't know. And so I think I would just say, we're all going to need to have some grace for how the situation evolves, and just take some deep breaths.
Lots of deep breaths these days, right? Little detail question. You mentioned the vaccination status in King County right now being around 80% of eligible. Does that eligible include eligible children or just adults?
Yeah, I should double check that number, but that is all eligible, is my understanding. But we are seeing, like I will say, the kids, the 5 to 12 is a lower rate than in other spaces, which is not shocking given it's,
right,
all of that space. So, but if we go to and I'm sorry, I'm on vacation, so I didn't do a good job of doing my background before I got on our call today. So I didn't look at today's numbers, but if you go on, King County has a great COVID data dashboard. And I can put that in the chat, and you can really go there and just see, even by by zip code, all of those things, what our vaccination rates look like, and how folks are doing. We're really proud of the work we've done. So I think I really say King County has really stepped up in this space. And I'm just going to say it because I can. A lot of people talk about, because infection rates are so high, especially with Omicron, we've heard from some folks that are like, well, in some of these other states like Florida, it's the same infection. So why do we do anything? And the reality is there are only 5 other states that have lower death rates per capita than Washington State. And I think King County gets a whole lot of credit for that, as well as statewide, but lives have been saved. Like, the work we have done, as painful and challenging as it has been, I just think, I don't want folks to underestimate what that means. I have parents in their 70s. I'm incredibly glad they're still here with me after this pandemic time. And it's because they took precautions and they did the things they needed to do, and we got lucky, And so I just want to say it's no small thing. And I appreciate it's been a hardship. And I also just really appreciate what this community and the residents of this county have done to protect each other.
Great. David, over to you.
Thank you. I wish I could say there was one thing. Shannon hit it. I said it earlier, staying flexible. I think that's the main thing. You've got to understand what's happening, where it's happening, so that you can flex your approach. I think is really, really important. And then Jill actually mentioned something that I totally forgot to mention, which is de-escalation training for your employees. That is something that we are embarking on here. It's been typical for our, safety and security folks to have that type of training, but we're extending that, all across office operations, event operations, because anybody can be confronted with somebody who's just not happy with the way things have been implemented, regardless of what guideline we were trying to follow from a government perspective. So I would definitely emphasize those two things. The monitoring thing, I think, is super, super key. And finally, testing. I think that is still going to be our best way to keep everybody safe going forward. Events have been, disproportionately impacted throughout the pandemic. We are desperately trying to find ways to bring those back, to get people to come back together again as groups, as larger events. The Motion Picture Association has a really, really stringent and wonderful way to approach this. If you look at some of their numbers within that industry, they have some of the lowest infection rates across the workplaces, and also a very frictionless way of approaching it. So we're taking a look at that as well.
That's really helpful. You mentioned de-escalation training, and Lee just put in the chat a link to one of the events that we did here at the Chamber with a really wonderful trainer. And he also, is able to provide that training directly to private businesses as well. So encourage folks to take a look at that. And last but certainly not least, Jill.
Sure. I would just, on that point of de-escalation, there's also, there are a ton of resources that we've been sharing from crisisprevention.com. So that's just another place you can go and find some resources. And I know they also organize training. So that's just another place to go. But I would also just reiterate what I was saying earlier about the importance of talking to your employees, talking to your customers, having that kind of like, people are really tired. Customer service is hard, even in good times. And so I think It's just really important to make your employees, especially right now during a labor shortage and it's hard to find people, like they need to feel like your employees need to feel like they are heard. So keeping those conversations going, making sure your employees know the rules, just really being kind of employee focused at this time. And as Shannon and everyone has said here, like understanding that your employees may feel different ways about it. So just being patient, being, but very purposeful in your conversations and approach to these conversations.
Well, thank you for those tips and kind of that advice as we close out here. We're really excited that, all of you were able to come on today. And again, as a reminder for everyone listening that this was recorded. So if you missed a question and still looking for the answer, you can tune in and take a look later today. That will be up on the Chamber events page. You'll also be getting a post-event email that will have links to some of these items that we talked about, the kcvaxverify.com, as well as a link to this webinar. So with that, I hope everyone has a really great Tuesday. I'm just going to be corny and say it all day. So it's just kind of fun. One of those things today. So take care and have a great day. Bye-bye.
Thank you.
Everybody.